Folks, it's been a while. I had to take some time away from myself just because, one, I've been traveling a lot, two, a lot of schoolwork when you're a doctoral student, and three, we've got to be real. Sometimes we have our bumps in the road, and I've been having a heck of a bump. I've been manic. And it took a while for myself to be honest about it. And that was really hard. Sorry, I had to move up closer to you guys. I didn't know how to admit it to my family, and I didn't know how to admit it to myself. And admitting when you're flawed, especially as a medical provider, is scary. You don't know what the repercussions are going to be. I'm really lucky. I have employers who rally around me, and when I come to them and say, listen guys, I'm having a hard time. I'm manic. I've talked to my doctor. This is what we're doing, and I would like your help. I'd like you to keep an eye on me and help me keep in check. Because I'm really good at compartmentalizing. I can manage to slow myself down to talk normally to you guys right now, to talk to my patients. But with everyone else, I just tend to talk really fast, and I tend to just have verbal diarrhea, and I tend to just let it all flow out and get irritable and drive everyone crazy and just have a big ball of emotions to just spew everywhere. And it's hard, especially at home. My poor husband right now, oh my God, that man. He says to me this morning, God, I can't wait till you're feeling better. And I'm like, oh, so that's your idea of support. You just can't wait till I'm feeling better. You can't just support me through this. And he's like, that's not what I meant. I know that. But the point is I can compartmentalize here at work, but I can't at home because I've reserved all my energy for the 8-hour day. And then I have no reserves left at home. And I've always been good about that. Driving in this morning, I was thinking about when I first presented manic. I owe my career to two people. My husband and my cardiothoracic section chief, a doctor I had known since I was a baby nurse practitioner. Without those two men, did not have a career today. And right now, I owe it to the fact that I have a boss who gets and understands me and knew from the day he hired me what he was getting and could accept that, and we could make a deal. You're looking a little depressed or you're looking a little manic, I get to talk to you about it and we get to make a plan. And we do that, which meant I got to walk into his office this week and say, you know what? This is how I'm feeling, and I was honest with my husband about it this weekend, and therefore I'm going to be honest with you today. And it's working. If I'm not seeing patients, I just stay in my office with the door shut so that I am not irritable, because I'm irritable as hell with all my coworkers whose relationships I value very much. The other thing that really kills me is I got this anonymous email this week from a nurse who shared with me that they have bipolar 2 disorder and lost their career because they had an emotional episode, details of which they did not disclose to me. Their boss found out and fired them. Didn't steer them to the EAP to get treatment, because folks, let me remind you, bipolar disorder is an ADA protected diagnosis. It means you cannot get fired for it. but she got fired for it. If she wants her career, they also reported her to the Board of Nursing, who yanked the license and told her if she wants her license back, she has to go through years of drug testing, AA meetings, and NA meetings. This nurse hadn't been using drugs. She has a mental illness. All those things were going to have to be paid out of this nurse's pocket for having a mental illness. This is how we get treated in the medical profession if we have a mental illness. We're not offered help. We're treated like addicts, which isn't what we are. We're not treated appropriately like we have a brain-based biological illness. It's not. Here's the name of a nice psychiatrist or psych APRN who can get you on the right treatment plan with some therapy and some mood stabilizers. It's, how can I profit the most off you with monthly drug tests? Let's get you into some AA meetings where you're not going to relate to a single soul because that's not what they're going through and what you're going through. Why can't we take care of our own in a responsible fashion? What is wrong with the system? Why are other nurses not getting the same response from their employers the way I am? Why? I've been at this rodeo long enough where I know what I need. I know how to compartmentalize, luckily, from the get-go, because if I ever hurt a patient, I would never be able to live with myself. And I've always known that about myself, patients first and second, which is probably to my detriment. However, this nurse's story really struck a chord and it really hurt me. We shouldn't be treating our own like that. When I was at APNA last month, this nurse did this fascinating poster presentation on these good states and these bad states and how nurses are asked about their license and how many states ask nurses if they've ever been diagnosed or told they have a mental illness. Guess what, nursing boards? You can't ask us that. It's illegal. Just because a nurse may have been told they have some depression doesn't mean anything. They could have been depressed for a period of 6 months because grandma died. And it hit them a little harder than it hit their next door neighbors whose grandmother died. You don't get to ask us that. It doesn't mean we can't be good nurses or nurse practitioners or clinical nurse specialists. Stop it. Think about you sitting on that nursing board, how you would like it if you were asked that. Come together. Let's take care of each other and take care of our own. This is why physicians are burning out. This is why nurses are burning out. We're not taking care of each other. We're not taking care of each other well. We have to reset the clock and we have to start doing it over and doing it over right. We all have to have bosses like I do, with a little compassion and a little understanding, so that in moments like this, when I'm not at my best, I'm allowed the opportunity to get back to zero and become my best. Every nurse deserves that opportunity because I promise you, I'm not the only one out there. But for the ones out there like me, follow me because I'm here for you and I'm going to fight for you. This is Ann and I'm Bipolar in Me. Please subscribe. I want to hear from you and I want to fight for you. Have a good day.